Teens and children with long COVID are displaying a range of surprising symptoms that often go unrecognized, highlighting the unique ways the condition affects younger individuals. Rose Lehane-Turenne, a 16-year-old student from Maine, is a prime example. Despite being a high-achieving student and athlete, Rose has been battling debilitating headaches and a host of other symptoms since contracting COVID-19 in March 2020. Her struggles reflect the broader challenges faced by an estimated 5.8 million children in the U.S. who suffer from long COVID, many of whom have yet to be diagnosed due to a lack of awareness about the symptoms. A recent study funded by the National Institutes of Health, NIH, has identified the most common long COVID symptoms in school-aged children and teenagers. According to the research, teenagers between 12 and 17 are more likely to experience fatigue, pain, and changes in taste and smell, while younger children, aged 6 to 11, frequently report difficulties with focus, sleep problems, and gastrointestinal issues. The study also revealed that younger children tend to display symptoms that are distinct from those typically seen in adults, underscoring the need for age-specific research and diagnostic approaches. The study highlighted that long COVID symptoms can affect multiple organ systems, with many patients experiencing issues in more than one part of their body. Commonly reported symptoms among children included back or neck pain, headaches, dizziness, and memory or concentration difficulties. Surprisingly, younger children also displayed unique symptoms like phobias, especially fears of crowded or enclosed spaces, and school refusal, which are less common in adults. Despite the progress in identifying these symptoms, experts caution that there is still much to learn about long COVID, especially with newer variants like Omicron. Dr. Alexandra Yonts, a pediatric infectious disease specialist, noted that most of the current data is based on earlier COVID-19 variants, and there isn't yet enough evidence to determine the long-term effects of more recent variants on children. As research continues, the focus will shift to understanding long COVID in even younger children, under age 5. For families like Rose's, accessing specialized post-COVID clinics has been crucial. However, the closure of many of these clinics due to funding challenges poses a significant hurdle for patients seeking care. Rose and her family moved to southern Maine to be closer to Boston Children's Hospital, where she receives monthly care at a specialized long COVID clinic. She has been treated by nearly a dozen specialists, reflecting the complex nature of the condition. As public attention shifts away from the pandemic, Rose hopes studies like the recent JAMA report will bring renewed focus to long COVID, particularly for children who continue to suffer despite the world moving on.